Well, we keep setting new records with COVID-19 cases, and state health officials say we have yet to hit that plateau in the surge.
It could be days away, though. Our Capitol reporter Michael Hyland talked to DHHS about that. Michael, the hospitals could still be dealing with the impact for weeks after.
Right, and some of them are already dealing with crowded emergency rooms and running out of people they can have there to care for those patients. The state's already waived dozens of regulations, but they're running out of healthcare professionals to move around to try to help with the surge.
During one of the toughest times in the COVID-19 pandemic, relief could be coming. Dr. Susan Consagra at the Department of Health and Human Services says North Carolina has not reached the plateau yet of new cases, but that could happen by the end of the month.
It's really hard to predict at this point, so we're continuing to monitor that. And certainly, right, hospitalizations lag behind cases, and so we know that we might continue to see that increase as well, even as cases start to plateau.
Every day is a new record.
Steve Lawler is the head of the North Carolina Healthcare Association, which represents the state's hospitals. The state recently asked FEMA to help by sending 50 medical personnel to the Charlotte area, where they're seeing the greatest number of COVID-19 patients. In a document, officials say the state does not have any additional staffing resources to provide.
We have hospital CEOs that are doing housekeeping work now. And we have, people that are C-suite executives, chief executives that are working in cafeterias because that's what we have to do.
In addition to steps like shifting employees around, limiting visitation, and non-emergency procedures, Lawler says some patients are being cared for in hallways. Nurses like Mika Douthit are concerned about what the next month will bring.
Some hope to see the light at the end of the tunnel. When will that be?
The state also established a transfer center where all of the hospitals across North Carolina can work together to transfer a patient from one hospital to another if there's space for them. Lawler said they try to keep people as close to home as possible, but at this point it's all hands on deck. Live in Raleigh, Michael Hyland, CBS 17 News.
All right, Michael, thank you.
We are seeing a record number of COVID-19 cases coming back positive in North Carolina.